Many people have a fear of something or another. One of the biggest fears people have is the fear of spiders. The researchers of this study attempted to use virtual reality to help people conquer this fear. The standard way of helping people is to have them face their fears in the real world. Therapists use exposure therapy by placing the patient in a situation that will cause them high anxiety. In this case, placing the patient in the same room as a spider. In virtual reality, the same can be done, but in a safer, more secure way. 30 people were recruited to see if their criteria met the requirements set by the researchers. The requirements included meeting a DSM-4 criteria for specific phobias, having a phobia of spiders for at least 1 year, passing structured tests, having no other psychiatric problems, not having a drug or alcohol dependence, and not having a severe physical illness. The clients were asked to take both a fear of spiders questionnaire, which is a subjective test asking questions about how one would react in a situation regarding spiders, and a behavioral avoidance test, BAT, which the researchers placed a tarantula in a glass cage in the middle of a room, and the clients were asked to get as close to the cage as possible. 23 clients were accepted to participate in this study. The participants were split into two groups, the treatment group and the waiting list group. The waiting list group did not receive any treatment and was asked to come back to take the same test 2 weeks later. The treatment group was treated in 4 one-hour sessions a week. The first session started slowly. The patients would enter the application Spider World, which is a virtual reality experience where a spider in a cage is sitting on the counter of a kitchen. The patient would walk into the kitchen and try to get as close to the spider as they can. When the participant was able to touch the spider, they could see it. But no tactile feedback was added yet. The spider would run away after the user. After this, the patient would pick up the vase that contained the virtual spider. If the patient broke the vase, an animated spider would fall to the floor. These 2 sessions were repeated until the patient reported to have little anxiety. During the final session, the researchers asked the patients if they would try the cyber hands, which would give tactile feedback and depth to the spider. When the patient reaches out to touch the spider, they could feel the textures on its back and legs, as well as the spider moving around in their hands. The results of the study showed the virtual reality exposure had a significant effect in the treatment group. There was no change in the waiting list group, which was expected. After completing the treatment, members of the treatment group tended to have lower scores on the fear of spiders questionnaire and tended to get closer to the tarantula in the BAT test. Overall, the study lacked a sizable number of clients to test this procedure on, but from the patients that went through, 83% of the people from the treatment group reported that they were less anxious about spiders. This study was both clinically and statistically significant. From this research, we find the virtual reality offers an alternative way for patients to overcome their phobia of spiders.